on Newsfeed. And we start off on a somber mode as former Tanzanian President Benjamin Mkapa has died, age 81, in Dar es Salaam Hospital. Mkapa was the country's third president after independence from Britain in 1962 and ruled from 1995 to 2005. Tanzania President John Pombe Magufuli mourns Mkapa, saying that he was saddened by the death and that it is a big loss for the country. Magufuli did not reveal the cause of Mkapa's death, and Tanzania will hold a period of 7 days of mourning, during which the national flag will be flown at half-mast. President Uhuru Kenyatta has also sent a message of condolence to his Tanzanian counterpart following Mkapa's death. Mkapa had most recently attempted to mediate between Burundi's government and opposition groups after disputed 2015 election plunged the country into crisis. However, the government repeatedly refused to take part, and the talks went nowhere. Back to the country, Nairobi Metropolitan Service Director General Major General Mohammed Badi has said that the NMS has escalated its preparedness in curbing the spread of COVID-19 in Kenya's capital, Nairobi. Badi has further called upon charity organizations to join hands with the government in addressing vulnerabilities, mostly in informal settlements. This as the government grapples with the increased cases of vulnerabilities caused by the COVID-19 pandemic. Let's listen in.
I'm very proud today to be here associated with a giant group of companies for this kind and noble gesture that they are donating foodstuff. This foodstuff will mainly go to the informal settlement and the less privileged community within our society. During this period of COVID, they are the most vulnerable and most hurt when it comes to employment, when it comes in terms of prevention of COVID, medical facilities. They are the most disadvantaged group in our society. So this will go a long way in not only helping but trying to alleviate their problems that they are facing currently, mostly in the informal settlement. We have started off this kind of gesture last month when unique group of companies donated mask sanitizers and other stuff enabled to contain the spread of COVID. So we are very grateful again. The giant group of companies are today donating foodstuff. You are all aware that the COVID statistics now stands over 9,000 and it is still growing. So we urge everybody to take measures according to what has been given by Ministry of Health. We are working hand in hand with Ministry of Health to ensure that this pandemic does not spread. We have already launched this morning an awareness program, also given by certain donors. We are working very hard to ensure that the less privileged in our society are taken care of in need of either education, in need of prevention. So, as NMS, we started off by supplying water from day one, cleaning the environment by cleaning the solid waste collection. We provided sanitizers. We ensured that all the women, most of the women in informal settlement were enabled to sew masks so that they could distribute them freely to the informal settlements who cannot afford the masks. This was sponsored by NMS with the national government, and we are now in the process of building 24 hospitals within the informal settlements. So by end of September, there will be new facilities in the informal settlements that will not only help the health standards of these informal settlements, but they will also assist in isolation because they will have inpatient capacity within those hospitals. So we are doing quite a lot. We are expanding Mama Lucy Hospital. We are expanding Bagavi to include 18 new beds and 10 beds, 18 new beds in Mama Lucy and 10 beds in Bagavi. We are increasing the isolation facilities within Nairobi, both for the staff of national government, staff of the county government, and Kenyans in general. So we are working round the clock.
Nurses and other health workers in Trans Nzoia are pointing accusing fingers at the county leadership for failing to operationalize isolation and quarantine centers. The medics are worried of their health since some of their members have tested positive of coronavirus and are forced to self-isolate at home. Our reporter Boniface Barasa reports.
Addressing the press in Kitale, the frontline workers in the region have accused the county government of failure to safeguard their safety, which has seen their colleagues contract the virus. Edward Cheriot is the chairperson of Kenya National Union of Nurses, Trans Nzoia branch.
We have colleagues who are now positive, and unfortunately, these colleagues have been instructed to isolate themselves at home, and we are very worried if this is the right practice for professionals. And we do not know the progression of the disease. Maybe the next day we shall call our colleague and they are dead in their rooms.
And it's very unfortunately wakisema a health worker aji-isolate kwa nyumba na ako na watoto. Like me, saizi nipatwe na corona. I have kids. Hiyo si ni sawa na kunipeleka kwa kaburi. Kwenye tumefika, hatutaki kifo. We don't want to leave our families and we are young.
Geoffrey Nyongesa, the Secretary General of Clinic Officers Union in Trans Nzoia, called on the Health CS Mutahi Kagwe to audit the Health Department in Trans Nzoia County.
We call upon the CS Kagwe to come and do a fresh audit on what's happening in health in terms of Trans Nzoia County. We have our new staffs who have not yet been trained on COVID management. As we speak now, we have more than five of our staff, particularly 7 in number, who have tested positive. We cannot going to take chances that we just given a single PPE you use for 2 days, like this one what I'm using. I've been using it since yesterday. I'm recycling, and I'm a healthcare worker.
On his part, Governor Patrick Haimba said all these challenges are as a result of inefficiencies caused by monopoly of Kenya Medical Supplies Agency, KEMSA, and called on the National Assembly to amend the law which gives KEMSA the monopoly to supply drugs and non-pharmaceuticals.
My last requisition for medical supplies, I think, was for 80 million. They supplied me 60 million, the rest have never come. And that's 3 months ago. So where am I supposed to fill in that gap? I don't know. So there's a lot of inefficiency. Go and check the market prices of drugs. KEMSA, which is supposed to be cheaper, is higher than the prevailing market price.
Kiminini MP Dr. Chris Omalo said he will sponsor a bill in Parliament to effect amendment of the Health Act to tame KEMSA's monopoly and allow private sector to supply drugs and other medical supplies to counties.
And by the way, I'm the one who passed that amendment on the floor of the House. But I've had a lot of outcry pertaining that law. And I want to confirm today, when I get back to Parliament, I'm going to sponsor an amendment to amend the health laws, particularly when it comes to procurement of medicine and medical equipments from KEMSA, so that we can have that competition. If we can have other maybe medical supplies which have been pre-qualified, so that counties can have an option.
Boniface Barasa, TV47, Trans Nzoia County.
Moving on, Embu Matatu operators have been faulted by Embu County Commissioner for flouting the anti-COVID-19 guidelines given by the government on transport. Several operators have already been apprehended and are waiting to be arraigned in court for violation of the regulations. Embu County Commissioner Abdullahi Galgalo has also warned bar operators who are flouting the protocols of dire consequences.
tumeshika magari kadhaa ambayo yanabeba kuliko ile idadi ambayo tumepewa na serikali, na tumewashika wengi, na leo wataenda kotini na hakuna mtu tutawacha. Mwito wangu kwetu sisi na kwa wananchi ni hii: tafadhali, ukiona gari imebeba kiasi ambayo imezidi, abiria ambao wako hapo ndani wasimamishe gari, waambie driver, tafadhali wewe ukitaka kufa, sisi hatutaki kufa, na mkatae kwenda mpaka apunguze watu, ipatikane ile idadi ya kutosha, ama mtupigie simu, tutamshika mara moja. Viongozi wa Embu, tafadhali naomba mtusaidie. Mahali ingine ambayo tumeanguka ni mahali ya pombe. Kuna baa zetu bado zinafungua na mlango wa nyuma, ingawa si peke yetu. Mumeona hata viongozi wakipelekwa wabunge kotini kwa sababu ya kuvunja hiyo sheria. Tafadhali, watoto wetu wanamalizika na pombe, na nyinyi ndio mnawamaliza, si watoto wanajimaliza, kwa sababu kwani hakuna biashara nyingine ya kufanya Embu isipokuwa pombe? Jamani, please, let's do something about it. We are doing it as security people. Nikiwaongoza na sikuwapatia nafasi, lakini siwezi kufaulu bila nyinyi.
Elsewhere, a section of Kilifi County pineapple stakeholders have started an aggressive campaign to market Kilifi's smooth cayenne pineapple variety to push for its market demand. Kenya Agricultural and Livestock Research Organization has pledged support to farmers by educating them through research on the best means of improving productivity of pineapples in the area. According to Kilifi County Chief Officer in charge of Agriculture and Livestock, Frederick Kaingu, farmers had increased their acreage and pineapples after they found that it is among the most beneficial agribusiness ventures in the county.
Structured farming, whereby the farmers will be profiled and enlisted to make sure that they sell or they only produce for a specific market. When we finish that level, then we go to the second stage, whereby we shall do multiplication of the pineapple seedling. So we shall have big nurseries to multiply and also to increase the acreage.
If the farmers have nothing else to use, we are making sure we are helping by doing research from Karo side to find the efficacy of what chemical farmers can be using just in case it attacks. But we want Kilifi to remain an organic pineapple county.
And on that note, let's take a short break. We'll be right back with more news, so keep it TV 47. Welcome back to Newsfeed. Now, Action Aid International Kenya has today donated detergents which will be distributed to all health facilities in Embu County. Chimera Mwachidudu, Action Aid Regional Coordinator, said that the donation of detergents will help fight against COVID-19 in the county. Elsewhere, former Embu Senator donated over 1,500 hand washing stations for the churches across Embu County. While receiving the stations, Bishop Paul Kariuki has urged the elderly priests with pre-existing conditions to stay at home, while those above 58 years and strong can attend mass only, and that, of course, they strictly observe COVID-19 regulations.
8,620 shillings. Na hii ni factory price ambayo tumeweza kupatiwa hapa, sio retail price. So ndo tukaona tuweze tuwakabidhi ndio angalau waweze kusaidia katika kupigana na janga hili la corona.
Joining hands with the church as Christians so that we make the church revival come back easily.
Asante sana Mheshimiwa Reni Kifuti kwa your contribution, kama vile nimesema mitungi 315, that is 6,300 liters, itawasaidia Wakristo wetu hata kule wako na mtu mwingine, kwa sababu watu ni wengi, pandale ya watu ende kufuata mstari moja, hata wakiwa na miwili ama tatu itasaidia ili watu waweze kujipanga vizuri.
West African leaders ended a day-long summit in Mali on Thursday without a deal to suit the country's escalating political crisis. 5 of the region's leaders met Mali President Ibrahim Boubacar Keïta and leaders of a protest movement clamoring for his resignation as a long-running jihadist insurgency threatens to throw the country into chaos. But the intervention failed to seal a deal, and Niger's President Mahamudu Issoufou at the talks along with the leaders of Senegal, Ivory Coast, Ghana, Nigeria, said that Western African bloc ECOWAS will hold a summit on Monday. The June 5th movement, named after the date when the protests began, has tapped into deep anger over Keïta's perceived failure to tackle the dire economic corruption and the 8-year jihadist revolt. China has today said it has revoked the license for the United States consulate in the southwestern Chengdu city in retaliation for the closure of the Houston Chinese consulate earlier this week. Chinese Foreign Ministry said in a statement that the tit-for-tat move is a legitimate and necessary response to the unreasonable measures by the United States. The latest escalation between the two superpowers is likely to hurt already ailing trade ties. When in late March, Somalia banned international flights to curb the spread of the novel coronavirus, in turn hitting imports of the narcotic cat leaf. Some of its users are now suffering withdrawal symptoms, as Tracy Mukami has the details.
In the sweltering seaside port of Mogadishu, Sharif Ahmed lunged at his relatives and neighbors, resulting in an emergency trip to the hospital in handcuffs. It is not the endless civil war keeping the 22-year-old restless, but withdrawal from the narcotic leaf cat, which he has been chewing since he was 15 years old. His mother, Halima Mohammed, brought him to a psychiatrist hospital, hoping that the coronavirus could finally break him off his addiction.
My son's illness became more acute when the cat flights stopped and the lockdown happened. It has caused the mental illness he suffers.
Somalia shut down its skies in late March to curb the spread of the virus, meaning the flights that import the drug from Kenya could no longer land. This has hit users hard.
They are complaining about bad dreams and lack of sleep, while others say that we were good when we used to chew cud.
The price of the leaf has surged to as much as 30,000 Kenya shillings per kilogram from 2,000 shillings when the flights were stopped. This has put the commodity out of the reach of most of its users, piling pressure on facilities at the Habib Hospital.
Out of the total number of patients we have, half of them are addicted to the drug.
There are more than 10 million users of cat around the world, according to the Nairobi-based Kenya Medical Research Institute. Nanok Lauren, TV 47.
Still on some bit of the international scene, U.S. President Donald Trump announced yesterday that he was scrapping next month's Republican Party nomination convention in Jacksonville, Florida, because of the coronavirus outbreak. Florida has recently experienced a surge in COVID-19 cases, which topped 4 million in the United States on Thursday.
But I looked at my team and I said, the timing for this event is not right. It's just not right with what's happened recently, the flare-up in Florida. To have a big convention, it's not the right time. It's really something that, for me, I have to protect the American people.
Away from that to some beat of sports, and Chelsea head coach Frank Lampard was left fuming at Liverpool's goal celebrations in their 5-3 league defeat at Anfield. The 42-year-old, who was involved in a touch